With Rokel Commercial Bank's SimCopper app, it's fast, safe, and reliable.
The world don't go digital. Now that's make Rokel Commercial Bank ready for match up with the world. This now the e-banking department. We get products and services them when you use online.
Is the only online TV that focuses on women. There are a lot of challenges, but with time, we'll get rid of them challenges there. I know so anything they start, you get forget challenges. Challenges is a part of life. So with time, we will improve on so many things. The responsibility now for share. Today we will look at the recent strives what the National HIV Secretariat don't do for second the fight against HIV and AIDS. Of late size alone, people are not take HIV and AIDS seriously again. But I want to tell you, say they are around. They are around and it's very serious. For pushing discussion further today, we get it Director General from the National AIDS Secretariat, Winner the family. Good morning.
Thank you. Welcome. Yeah.
So we look at the discussions now. We want to look firstly, let's look at the topic of discussion today. What are some of the steps they will don't take as a secretariat? Because we know what we done they do the years have been so active. So one for see what are the new steps they will don't take for second effect.
Yeah, thank you very much. I think we don't take a lot of strides and we still they continue for work or ensure we're able to achieve, the global targets that we set and ensure HIV no longer a public health threat in Sierra Leone. It's like a journey we will be start. When you start a journey, it's like you can make a lot of noise. But when you don't begin to see light at the end of the tunnel, maybe the last mile and can be the most steepest and the most challenging and then the most important aspect of the journey. So we don't really try for ensure we remain on course. Okay. Though we get so many challenges with financial or let me say, resources that we required in the response to HIV and AIDS. We've been getting mostly from with development partners. And then development partners don't cut down on them funding. And we not just sit down and say, because they don't cut down on them funding, we're not going to do anything. Government, they actually try. Government, they really take them serious. But we don't just make noise about it. Because,
okay, so why they get cut down on the funds? Because I know recently, a couple of 5 years, 6 years ago, the Secretariat been so active. Every journalist want for reports for HIV and AIDS. So why they cut down?
It's not on our own part. Country where they support you. The country themselves, they develop their own plan. Themselves get their own financial problems. So now then they decide, they not even look to you and say, this is how we want to go. These resources will be the give una, we're not going to continue for give una this amount again. When they cut down, when I begin take over on your responsibilities. So now then problems that we currently go through, but at least we have they come up with some strategies for ensure we keep the response afloat and ensure we begin deliver the required result, because we don't set ourselves a target, government don't set itself a target, government say aim for overachieve the global targets when 98 by 2030. And a lot of people not going to understand the 98, what do you mean? The first 98, they refer, 98% of all the Sierra Leoneans are waiting on treatment. 98% of all the Sierra Leoneans are where they live with HIV. We offend them. You get me? We for test them. And when we test them, you understand, 98% of all the one that we positive, we for put them on treatment. And the last 98, they say, of all the persons that we HIV positive, we want to put them on treatment, 98% forget viral suppression. And the global target is 95, 95, 95. We on government, for sure, say they're ambitious and they really want done with the issue of HIV as a public health threat. So they set that huge target, and we actually they move towards that one day, and we'll be making a lot of progress.
So let me look at the current state of HIV in Sierra Leone.
The current status of HIV in Sierra Leone, now 1.7%, and the prevalence rate. Because we not do any national study yet. This prevalence rate we the quote now the last DHS with the Ministry of Health been do with all the partners, because the demographic and health survey been cover the entire country. You not go just go in a corner, you do a study, then you generalize and say this not the prevalence rate for the country. You know, certain criteria and the way you get for meet, you know, for make it say, oh yes, this prevalence rate, it represent the country. So we'll not do that kind of study yet.
So
but
this way they talk about, so this particular survey now when they do it?
I think it was done in 2018.
So as it is now, we'll not get
No, we'll not do any prevalence study yet. We're not a national prevalence study.
Okay, that brings me to the question where they talk about the UNAIDS 95,
yes.
85
Yes.
targets by 2030.
Yes.
So how far we don't go with that?
For Sierra Leone, we're currently there at 87, 86, 63.
Which is quite encouraging, right?
Yes, 87 means 87% of the people where they live with HIV in Sierra Leone don't know their status. But we target 98.
Okay, so now get 3 more.
Yes.
So
Then the one that we don't put them on treatment, 86% of the Sierra Leoneans that where they live with HIV are currently on treatment. This data where are the
86% they take treatment.
yes.
How many where they live with the disease where not they take treatment at all?
We get estimates what we can do, you know, for making guide. You see, this data we are give you now, the 2024 data.
Wow, so 2 years no data.
No, 2024 data. You know, globally, now so we can normally work. You know, a software the way UAIDs, where we call Spectrum, we then develop when all countries they use worldwide. So now through that now modeling software, that software you put in your country information, country statistics.
Then
so in the able give you get me.
Yes.
And right now, as I tell you, maybe within the next 1-2 weeks, we will don't finalize 2025 data.
Okay.
Then we'll tell you, say, as at 2025,
Okay.
this is our data. But I can tell you now, say, we get over or very close to 90,000 Sierra Leoneans where they on treatment. With treatment, they seem for work very well. Okay? Because we test you today, we put you on treatment immediately. Because once you're on treatment.
So it's mandatory. So if you test positive today, then if you take it.
Would they encourage you one time? We'll not they force you.
Okay.
But would they encourage, because now you're right.
Yes.
Would they encourage you, say, hey, this is not the trouble, oh. Would they counsel you and encourage you? And you say, go see reason. And say, yes. When I enroll me on treatment. Because somebody.
So is the treatment free?
It's free. You don't pay.
Across LU?
You don't pay a single cent for treatment.
Because some quarters of the public complain say, then they go to their hospital for the treatment, for the medicine, and then they get Sunday they even sell and yeah.
No.
So how one can monitor that?
We get staff the way they move around. Then you know the most interesting thing, we'll bring in one program we'll call community-led monitoring. Okay. The community-led monitoring, now the people that way they live with the disease. Now they self they monitor the facilities.
Oh, okay, that's fine.
Because they know say na their own issue.
Yeah.
So it's like when they don't monitor, like any side with drugs, no, any side with challenge, then they bring them to our attention. Okay. Then we can act swiftly.
Okay. I think that's a very good strategy.
Yes. Now then they
because
actually lead.
There is this proverb we say, he who knows it fears
Yes.
So if then champion your own cause, that is a win-win situation.
Exactly.
So now let's look at what are the biggest challenge we they face
The biggest challenge
in the fight against
the
HIV
biggest
and
challenge
AIDS.
we
Yeah.
they face now resources first. Then that are a very big challenge. But we thank God the little way they try for make the best out of them. Then the second challenge we they get stigma and discrimination. Because a lot of people they stigmatize against the people the way they live with HIV. But I can tell you, for each one, we they put in a strategy. I they tell you now, say we get cases in a court, magistrate court. Where then they prosecute people them we don't stigmatize against people living with HIV. We don't create a system, a network. We get a toll-free line. This toll-free line, when you call, it's 24 hours, and they operate for 24 hours. When you call, say they stigmatize against, they document. When they document, then they send unto we. Then we they send unto we legal retainer. We already get a law firm.
Okay.
You know, where every month, then they provide to we report on the progress of the cases the way they go on. Because we self, they get the documents. So we they watch we self for see how things they go. So some of them stigmatization issues the way they come, the legal firm or the legal retainer what we get, if they look into the issue, then get something we call alternative dispute resolution. Where they go say, no, we don't need for go court. This will be able to handle among we self.
Okay.
So it's like somebody we stigmatize, they go apologize, whatever. Then the person now where they live with the disease, they go say, okay, you know what? May they be so Jama now, you know? Like they try for give them support now for community acceptance. That's one issue. Then number two, we also they work with the Human Rights Commission on this stigma issue. Human Rights Commission, they go into communities, you know, where they get a program what they call mobile complaint hearings. So people that way hard to reach, then they come with the complaints that way then they document and see how will they move on with this. So far so good. The issue of stigma, that's where we are. Then the other challenge where we they get, it's like we get challenged with adolescents and young people. Because what thing they happen, based on the data where they come in now, the new infections, if they come among this new group. Now this new group now where we don't see, say, hey, the prevalence rate, new infections, don't they come up among them. So we design a program and see how we can able engage them and see how we all can able work together. The one that we don't become already infected, we see how we go put them on treatment so that they will start to get continuum of care for ensure say they're not able to transmit. And the beauty about HIV, what people don't know, is that when you are tested positive today, you can be very strong. You self not even know. You test positive, then put you on treatment. And when they put you on treatment, you adhere to your treatment rules. Within 3 to 6 months, you get that thing we call viral suppression. When at the last 98. And when you get viral suppression, it don't mean say you cure. Any sophisticated test where you do, you know they pick up the virus. That don't mean say you don't cure. You will continue for take your treatment.
Yeah.
But it's like you not any longer a danger to society because you're not able to transmit anymore.
Some people like you look at the other way back, just before you come in. Then you look at say the HIV, the whole process of dishonesty can come. Sunday can live with him partner, he go hospital, he tests positive. You know they can't tell him partner. Don't association and the one partner can positive. Why is the other one not positive? So I can address.
Interestingly, we can refer to them people as discordant couples. We get discordant couples now we program. All right? Like the man can be positive, the woman negative.
Yeah.
Or the woman negative, the man let me say the man positive, the woman negative. Or the woman positive, the man negative. Then they support each other. Meaning that the relationship not a break. HIV not for be a cause for a relationship break. And then two partners can live together support each other, and as long as the one they adhere to treatment, anything where a normal person they do, it they do am. Then people and they like if na woman positive, that woman they get belle, a born in Peking negative. Because
So
we have a
even when
program
they
for all
get
that. Yes.
intimacy,
Yes.
no transfer.
No
How will
trans-
it happen?
As long as you get me, when I say when you adhere to your treatment, you get viral suppression. You're not able to transmit.
Okay. So,
So that's not the area where the person they taking treatment.
Yes, you dey take your treatment, you adhere to your treatment. And all the one that we HIV positive, we can put them on treatment. Let you know how expensive the program is. Every 6 months, would they test you? For ensure say yes, you treatment they work. Yes, you treatment they work. But still within with society, we get denial syndrome.
Yeah.
This denial syndrome, it don't they lead we to somewhere where the program they become very expensive. When I advance HIV disease. Because what in they happen, some people and they can test positive today. Then go, they know say they are HIV positive. They not agree for take their treatment. Then they wait very late. Like when they present themselves now at the health facility, it don't late. It don't they now at that advanced stage. And for manage them at an advanced stage, it's very expensive. But there is a program because government, sincere and government, they try for serve everybody, irrespective of your status. Government come in with a program in cooperation, in partnership with them with development partners, and in collaboration with development partners. So ensure say the one that say where they come with advanced HIV disease, we able to manage them. And if you are lucky, God no mark say you term done. If you are tested positive, you present yourself very late at the facility, would they put you on drugs, on treatment? Once you terminal reach, maybe within 2-3 months, you go see an improvement, then you go end up forget viral suppression. If you end up forget viral suppression, you're not like a normal being. You can move around, you can do anything where a normal person they do, and you can't transmit the virus.
Let me talk about the rural environment. How una they work towards them people anyway then they are inside and they, because imagine somebody they Kubola or they Mongo, how will they get access to in case you want to do the test, or let me say we are in permission they don't do the test but it's still say
Well,
a day in that
okay.
party.
These are the one area where we they try for work on right now. Okay? The Honorable Minister of Health, the Ministry of Health, they don't come up with people-centered. We don't take HIV as a people-centered, disease, and for ensure say a life cause approach. So we they move towards integration. What do we mean by integration? We don't want to let any clinic exist that say this is an HIV clinic. You get me? You go to the health facility, all what thing you supposed to get, all the programs, you get another one-stop center. So I think this is the move now where the government they try for move with. And we self don't see say, yes, it's a very good move. And we also they try for ensure say HIV not to any longer a health issue. Because the issue of integration what they try for talk about. Take for example stigma and discrimination. Stigma and discrimination are human rights violation. So now I make we work closely with the Human Rights Commission of Sierra Leone when are their mandate. You get me? We just they provide the technical know-how. Then they integrate her into the system. So tomorrow, when no resources not there globally, then we know say it don't deal within with programs, they can move on with them. For the workplaces, we they work with the Ministry of Employment. They don't come up with a workplace policy, done at their mandate. We they see how we can integrate program with them so that all HIV issues within at the workplace, then they can take leadership in that one day, using their own mandate. Because if we at the AIDS response, we just go team up like the Ministry of Gender, say or we begin go sideways, not to be mandate, it can become very challenging. So this issue of collaboration, would they collaborate? Even with the Ministry of Gender, because you get the gender dimensions of the disease. We work closely with the Ministry of Gender and Children's Affairs and programs, and they wait and say, don't they take lead on them for see how we can able move on with them.
All right, so earlier on, we did talk about stigmatization and all that thing. So
Yes.
this one for me, I ask how community people or the point where they live with them HIV people so how they were able for help una for secure or for make them able get them treatment them.
I tell you, say, the one of the programs, what they do, one of the key partners, what we they work for,
Okay.
that are the people where they live with HIV.
Yeah.
For me, now because they make we exist, we own institution.
Yeah.
So we do work closely with them. So they not establish support groups. You get me? In all districts, they get support groups. And in only on in not only in there, we get other partners. We also do work with. We would try for enforce community leadership, for make them take ownership. Community leadership in the sense that then they do outreaches in their remote communities, you know, where then they actually bring in people them we really need services for let them actually take advantage of the services. We get peer navigators. The first when they say peer educators, now peer navigators. For me, say when we don't take you as a peer navigator, you know the job there for educate is like you did navigate within communities and engage with people, and where there are challenges, you bring them out. And I tell you, say like the community-led monitoring, when people living with HIV, they take lead in that. When they don't do them, every quarter they can come say, oh, we don't do monitoring, it's independent. Then can present. You know, so we and all we partners there, we go discuss where there are challenges. Right from there, we begin address the challenges. We begin give action point or responsibilities to some partners and say, hey, you take lead in this, you take lead in this, you take lead in this. And we and World Vision would work closely, and the UN system would work closely. We get a lot of partners there. And when I've been talking about adolescents and young people, we get a program now. We would also collaborate with them. We will call them adolescents and happy kids. Okay? These are adolescents and very, very young people where they live with the disease. We don't empower them. And themselves now, they really work for seek their own interest area, their own cohorts, for ensure say themselves benefit by the program. You know, this is like a national cake. You get me? A national cake. You not go just sit on at your corner and say, oh, I for benefit by this cake. You get for be part of them. You get for be part of development, and you get for be a part where they actually push, you know, for ensure say, yes, you own people the way they represent, then say benefit from the cake. Because the cake is small, but you get for participate. They have some good ideas. When they bring their ideas, and we're not technical people, when they bring their ideas and we can sit down now for see how we can design that idea for make it be a very good program where it will actually turn out results. And what thing I go do now that wanna reach out to me, I think what there's a video where they even go out from adolescents and young kids where they live with the disease.
Yeah, because
where,
now that's I just want
where I
ask.
go share with you now
Where-
for let una know the role where themselves they play.
Okay.
Yes.
Okay, 80 to 90,000 people get HIV in the country.
Then they on treatment.
Then they on treatment. So, yeah, then they on treatment. So how many percent, when it comes to percentage, 10%, 20%, how many of them they take the treatment, and also how many of them not they take the treatment?
We get challenge we can call loss to follow up. Loss to follow up in the sense that you get some people the way they come in today, you put them on treatment, they go begin take that treatment day. Well, they adhere, then all of a sudden they begin break off. And it shouldn't be like that. Once you are on treatment for life. You get for continue. So we get the challenge, and because a lot of people they drop out of treatment, then make they get a support groups of people where they live with HIV. And we also they try for empower the support groups and for let themselves help we and bring them come back on treatment. And other programs and they, what would they give them targets? They are bringing them back on treatment.
All right, so now let me talk about the example. I get HIV. This person gets HIV. To start with first, you dey talk about adolescent pikin. Wetin are the cause, or wetin really dey happen? Wetin are the effects why make they dey get first the HIV? Because at that very young age, dey pikin get that kind sick day. Wetin are the cause?
Okay, fine. Some picking and they, because the mama them is HIV positive, they refuse to know their status. Then become pregnant. That picking they get for end up for be exposed. It will become positive. So even if you're on treatment, if you are a woman, you're positive, you're there on treatment, that picking we get, where they born, would they refer to that picking as an exposed child? So you know the only end though, you don't continue with the treatment is that you don't add one more load to it. We get for follow up on that picking day. We get for the test them. 6 months, 12 months, 18 months, up to certain period. So if we in all them tests and if the picking come out for be negative, then that picking don't become negative for life. Meaning that you don't get the transmission. So this is now one area we would actually push for. And you remember I talk about integration.
Yeah.
And I also talk say we try for integrate services. You know, pregnant women then they go for antenatal. Then they go to clinic, eh? So all we want is when you go to that clinic day, request for do HIV treatment. Request for your test. When they test you, if you're positive, would they give you support? Support in the sense that would they put you on treatment and that baby waiting at your belly? Would they try now? It don't become a responsibility now for protect that bikini. For let you know born HIV positive. So we not serve like as media people. I know say we all they live in communities. We not serve get a role for play in this particular area. They will not just put the role or the responsibility on government alone. As long as you live in your community, you see a pregnant woman, you get me? Then in a community there, you get tete-a-tete to the person, I think you can encourage that person there, let go know in HIV status. So that at least that offspring will not bring that the world yet. We try for begin protect them. If you do that, then you don't begin perform one of his civic responsibilities.
Okay, that brings me to the question,
Yes.
testing and treatment.
Yes.
So there are a lot of time people are not being bold enough. Like for me personally, every 6 months I do my blood work. Because I know it's very important.
Yeah.
So salon people and they all even hospital they sick. But for we don't travel, we know it and we care so much about our health. Inside the year they do blood work twice every 6 months, including when I say blood work, all of it
Everything,
me high, me teeth clean and get healthy. But we they see inside this country, especially young people, whether they even go to hospital, say get boldly. Pass sick don't hospital and I see them they get and they go. So what are some of the strategy we want to put in place as a secretariat for ensure say we get more people for test and more people who don't test, we don't positive for go for the treatment?
Well, we desensitize. We get with peer navigators. We get with other people, we and partners.
Okay.
We still try for mobilize people for let them do an HIV test. And you see, I'm glad the way you relate to this issue, where you come up with this issue, saying people know they ever go hospital, then they wait it don't late. You get me, eh? So because of that, we self don't begin to notice advanced HIV cases. Because the time where it presents itself, it's like it don't late. You know, even in a stage 1, stage 2, it may be like the last stage, waking that at any time.
Yeah.
You know, and one thing we make also say is like, let we begin to move away for this issue. Most of the young people will say, oh, I get malaria and typhoid. it's like it don't become
Normal.
a common
very
diagnosis of the country. You get me? And much amount body the way it dey, if any odd thing go inside, your body they tell you, say, hey,
And
you
sometimes-
need for go
Yeah,
investigate.
make I just clarify this. This question we talk about, so this high open away give. Sometimes then the lab technician in back can get a role for play. So don't you think say una for collaborate with and partner with them? Because especially me, I don't see a lot of people that when they go hospital, then just they stick onto this malaria and typhoid. Sometimes the person get other underlying sickness there, you know, they even know. They rely on them, say I don't can do test, I know well. But always the testing they carry it, malaria and typhoid. So it's our time the secretariat would elaborate, especially the government, you know, una work closely. Because if somebody don't go do test and malaria no more, when he gets HIV, he gets hepatitis. But no, no, state and
So okay, thank you very much. I mean, we not government. Okay, we not government because we institutional government establishment, so we not part of government. And you know, earlier on, what I've been talk, I say we did try for move towards integration, so that the response let it be people centered, and also this life course approach. You get me, a life stage approach. So it's like through this integration, where they talk about the lab personnel, etc.
Yeah.
We want for ensure, and we dey move towards that one day, for ensure say you're gonna any primary healthcare unit, any PHU or any clinic, we dey. All the ailments, HIV not for be in silo anymore. Like for say, oh, na HIV corner and no, it's like all the services they go able render them. And government they also work on something way very good. We they pray, you know, and it's tough, but you not go say you not go do them. This health insurance scheme, I think government they try for push them. And if them push them, no, I believe say them go pilot them first for certain layer, you know, so that if you work out, the issue of universal health coverage, okay, will move very well quickly on them and ensure say everybody get access to health, because now you right, okay, now you write down and they forget access to health. But what Mickey always says that the way we can look at HIV, you know, when they look at we can also look at from the human right perspective. HIV issues are a right issue. And when you get a right issue in there, it also get for good responsibility. So it's like, who say maybe your right stop, now they the other person, it won't begin. And with your right, you get responsibility as well for ensure say you know disturb the other person your own right. So these are some of the issues that we would actually try for work towards. And I believe say with the way things are going, definitely things will work well. And I believe say we don't really see if you see the health facility, you see the healthcare delivery, you actually begin to see 5 years back.
Yeah, there are a lot of
you go
but
now
then this particular problem
facilities,
they
yes.
still not be
Yes.
addressed. Reforms to happen.
Yes.
Then nobody no go able for denying that. Sometimes then we can be critical, but this particular reform where they take place in the health sector, people they need for saying that not the truth. But notwithstanding that, there are still challenges, all age challenges, attitude of nurse, the issue of privacy, the issue of mistaken test. For let them correct and back, it don't cause a lot of problem. So it's our time when you fight, everybody they see them. As I tell you, I have a young journalist who always they report for HIV/AIDS. We see una fight it very visible across the area.
Yes.
But sometimes then they again, though they look at the challenges, people in this country not get confidence in the laboratory, especially the one in Africa, for go do test, because then they get complaint of mistake, do the wrong swab. For instance, somebody very close to me, we at Kego Hospital. I care for them to go do all in blood work. They left out the urine. They keep her for about 2 days. I go with her for the results, and they go with her buy medication. The doctor opened the results. The urine not the day. Go to the lab. the person don't keep the urine for 2 days, then you want come for contest. I say you can't do that. So that are clear manifestation say the lapses in that this they create make una not they get boku people the way they go for trust
Okay.
not dey.
Thank you very much. You see, this not to issue we just start today, and make him put to the general population. We all Nigerians. I think for me, one thing I really want to say, we really need for be patriotic. We put our country first. You get me?
Yeah.
And areas the way we country know they do well, yes, we can talk about them. The one they go make the one the way they lead we for sit up and see how they can able address them. But one thing we be say when they can say government, now the people them now they get government.
Yeah.
Not to the leadership of maybe the president, whatever. We just get a responsibility. Say, you know what? You lead we all. So we need for really give them like all support for ensure say make able lead we all and ensure say we all drive na the same boat.
Yeah.
A clear example what can give this country would they complain of water. Yeah, resources not there. Guma go come, or even apart from Guma, you the private person, you go come, you pass your pipe. You get me? And this your pipe, the community members and they get access. You make provision for them, say for let them get. Within that same community, somebody go come, it just cut them off. You know, these are some of the issues that what we really need for really work on. I know say it will take time because Rome was not built in a day. And I believe say we are gradually getting there. And I believe say we go one day reach there. If we all decide say, okay, you know what? We don't get any side for Gunaya would they remain.
Okay.
So that we all work together and push up.
I will talk about woman and young girl picking them. How woman they continue for get high HIV positive than the male?
Okay, the reason first. Because I tell you, say new infections. They come out from where adolescents and young people. GBV issues. A very critical issue. You get me? It's early marriage. You get me? Rape. Then also, let us look at poverty. You understand? The sexual behavior. You know, now a particular group, when you reach the, we all don't pass through them group then day. It's like when once you get there, you know, you the feel say now, oh, you can take life and move on. Now your responsibility. You know, you get a lot of factors the way they trigger you. You know, for be like a misfit. Where you not go behave like how things been there before. You get me? So some of them things and they lead will picking there because your brain not actually mature it for make it really sit down and assess say, oh, if I do this, you know, these are the implication. You take for example our universities. A lot of our guys are going to the universities. When you look at we on time will be they go universities. You know, get anybody where they go like a university below 24, 25, you get me? But now you they get 19-year-old, they go university.
Yeah.
You know, 20-year, they go university. And those days, you get me? When you go university, you are moving away from your parent. It's like independence don't already start. Wherein you are not properly prepared for that. So it's like when once you get there, you know, a lot of, you know, convincing from you cohort SEM can lead you into all entity. So these are some of the issues then. So we really need for educate them and for we, adolescents and young people, we they refer to them as vulnerable population. We already classify them as the most vulnerable population what we need for focus our attention on. Because for them, when they talk about vulnerable population, they could be start newly when they say key populations, etc. You know, but now with the adolescent would refer to them now vulnerable and at the same time the most at risk group. So it's like whatever program would they actually try for really push towards them and see how they will able to begin to change their behavior and see how they will begin to think about their future. Because I can tell you with the HIV program, if you buckle your foot, one miss, you get yourself infected, you have to live with the consequence.
How una can engage the university when it comes to this HIV and AIDS problem? How una can talk with lecturers them? Because I believe say every university gets a clinic or a hospital like we are in. Maybe some say you sick, you run with it. How una they work with them?
With the work closely. You see, like me own office, you get me? Me own office not actually there in implementation.
Okay.
Me own office not for coordinate. And for ensure say we develop strategies and mobilize resources.
Okay.
And coordinate all partners there. Then we own mandate. We get a program under a department under Ministry of Health, we call National AIDS Control Program. And then actually they implement NACP.
Okay, so
But we dey work closely with them. How we they behave with the universities? We get we partners and we dey actually target the universities. Very recently, one of the critical things we do is that we can normally get like International Condom Day where we dey involve the universities. Then we can do outreach where we can go establish booths them, for let people they know their status. We work with the university authorities. Then we provide services as well for let them also take advantage of the services. Very recently, through the health unit in IPAM, we've been for donate condoms to them. I talked to one of our partners then I sell them condom. Care International Protector Plus. We are able to provide for them, through the health facility, so that anybody will come, we need them, they will be able to access them at no cost. So these are the kind of ways that we will work. Then we also they partner with their NGOs and CBOs. Would they encourage and say, Bodia, this is a group, a day within your domain. Find a way of really reaching out to them. If you need real support, like let me say with the authorities, we can take the leadership or engage with the authorities in partnership with you so that you can carry a program there. Because the jobs they go do something of that nature.
All right, quick one. Let me talk about the progress we have already continued to achieve from the top to 95 targets in the global.
Yes, for me it's like we're there at let me say 87, 86, 63. Yes, then a huge target. What to achieve. Because mind you, the global target is 95, 95, 95. Government say in the medium-term national development plan, so for achieve 98, 98, 98. And one big thing where I can say, last year, now we get this big shock. We do not begin withdraw or begin cut down in them funding. We program was wise enough. We continue for deliver. And we don't they deliver, you understand, a gap no day. When I say gap, what will be they do? Because it's like when you put somebody on treatment, now the most difficult thing, and you say not free. That person, you got to continue for provide treatment for them. Whether you get, you not get. And thank God, with the treatment issues, is like it has never been interrupted. Yes, we can get stock out issues like you go to some facility drug no day, but it go more than another drug or the drugs and they on the high sea they come. But we they find a way of navigating for ensure say you continue with your treatment. We may not introduce a program where we call DSD, differentiated service delivery, meaning that not only facility for get treatment, you forget your medication. That make we call on differentiated service delivery. We get a lot of people that waiting on treatment. They don't want to go to the facility for take their medication. It's like we and they discuss and agree. Some people like somebody go there like within this community or within this building. You get me? We they on treatment, but nobody know.
So
then
me,
it go your arrangement go there where you not go know.
so why the issue I get with that? Why people not be bold enough for talk about their status?
Now the let me tell you, now the stigma. You see, it's a blunder. You know, the global response to HIV when we started newly, now create the problem. Because it's like we been get posters, we been get banners then. You get me? We been get billboards then. Then they paint somebody in picture, you they show, see all this erase, say HIV can get you totally wasted. At that time, they now be like a death sentence.
Oh yes.
So we still they leave. You know when you don't cause
the
a damage.
first approach.
Yes,
Was
it's
wrong.
like you they try because at that time people were dying, and we don't discover now over the years. Say yes, the way HIV they go, HIV now for me a community issue. Community leadership is very critical. So people and they all been they put on treatment. The DSD working though differentiated service delivery. We get clients and where we say this is a stable client. We get in drug, they taking drug. I like nobody know them. So we been give them a refill like for 3 months. But when we can don't discover, say, hey, would they get some stock out challenge? The person they understand. Say, you know what? We're not going to give you 3 months supply. We'll give you like 1.5 months supply. The person, you know, the vex, he understand because not to in one in colleagues and self day.
Okay,
You
so
get
una
me,
get patient the way una dey carry drugs go na dey go deliver for them.
Yeah, no, yes. Like we don't discuss Patients and they go say, no, me not the come home. And this person will come pick up.
Because
the
of the
drugs.
stigma.
You get me, Or patient will say, you know what? Let's just meet up at that point day.
They give me.
Yes.
All that na because of stigma. Because
Stigma, you
I
know.
not see salon. You get like America and other countries. You get people the way they live with HIV/AIDS. Then so bold enough, then they go on radio, serve as ambassadors, talk to people. Them, but salon,
We not reach there yet.
Why you say we not reach?
We not reach there yet because we say.
You don't think say that the honest thing where somebody go do?
But if one thing, you know, somebody in health records, you got to keep them very confidential.
Yeah, no.
Assuming,
But,
okay, me HIV negative, like way I did, low assume say maybe HIV positive. You get me? I did take my medication. Now, you know, it's my right for tell you say me I dey live with the disease. I go public. You understand? Those some them day we don't come out.
Yeah,
And
because
what's
na
in
one way than they will
what
go.
exactly? We get big people in our society. We they on treatment. We they try to encourage them, but you can never force them. And I don't get any right for go tell you say this person now they live with that disease. No, if the person want come out willingly, we they give them all the support.
So now can hear people awake you and serve as ambassador for come and preach about
Well, this is where the, among like people that way in higher echelon of society, now they actually will want for like they actually come out.
Yeah.
Because you see the people the way they actually come out, not to them one that we don't deal like that position they need. Because most of the people the way they come out for say I'm living with the disease, it they like their lower cadre or middle
low
level
profile
cadre,
people.
low profile. So this is not the challenge, but I believe say
But then we'll still see and like somebody you go still get a message where they send.
of course they
You
are
go
doing.
able for motivate a lot of people for go for
Of
test.
course they are doing it.
Because Leonie over 60% of we in this country no one for go to test at all.
Of course they are
They
doing
no one for do test. Then they only do as I said before. They only go to hospital where you don't get worse, which is very bad. So lastly, as time on the catch we. Generally, what you will be your final word in terms of testing, in terms of medication, especially among young people.
Okay, for me, the most important word we are this year is that testing and at the entry point to HIV. Every individual necessarily need for know your HIV status because then I determine your future well-being society. because the virus is such that when it gets into your system, it begin eat into your system and it make you very weak, and all other ailments will begin come. So the best you can do is, this now one risk we already exist. Try no say yes. You already risk free of this. Go and know your status. If you know your status, we will put you on treatment. And it don't mean say we get HIV, that's the end of your life. No, the treatment they really work. We get people that we HIV positive, we don't put them on treatment, we don't achieve viral suppression. Is that then people that they can no longer transmit the virus. We get people that we like the man positive, the woman negative, they don't born picking them, they picking them negative because the drugs they work, they really work out. But the final word that to develop woman and their husband them or partners them. Do ya with the big. Then we support with partners them. Let them go in a clinic. They go normal pregnancy clinic. Let them request for the HIV test. Let them do one so that at least if anyone positive, we'll be able to save that picking. Because in we own generation, we own country now, you know, a painful somebody die and not get picking. A painful like wait and say, oh, in generation don't know. So if you already positive, you don't get that picking day. But let the world continue for remember you, the community. Even if you die out, that picking remain negative. They will always they point to that picking. They say, oh, that been so person in picking. And that picking will continue for remember you all the time. If you be somebody in a society, you will always begin to say, oh, me mama, you know? So it's like, your name not will ever disappear.
Exactly.
So now I make they encourage them, Bella Woman, there. And we then, partners, the one that win a partners to Bella Woman, them, let them encourage them. Let them all too. You know, the one I can do, testing together for see how we can able support. So now that way they may go one say, and you are let them get confidence in the response to HIV. It's not easy, and let them not put blame on government. We all get the blame, you know, so let we all take responsibility together.
Okay. Thank you very much, Enemna Abdulrahman Sise, the Director General from the National AIDS Secretariat. And today we talk about the drives where they don't take as a secretariat for ensure say the fight against HIV and AIDS curtail na Sierra Leone. Today we talk about a lot of things. It tell we encourage we for do more testing, and women is still the lead in terms of HIV and AIDS. We still high, and this is a wake up call to every woman, especially pregnant women. When you go to hospital, try for know your HIV status. It will save your unborn baby, and you will able for live healthy. So go now, go do your test and know your status. For let you know your status very early, it's very important. When you know your status early, then we're able for treat you and you're able to recover. Not say pass you sick before you go to the hospital. So plenty thank you to the studio guests and also to the technical team. We have been the program today. My name is Femi Koka.
And
So join me again at exactly 11 a.m. for Levi Council program. They made an edition of newspaper review. Tomorrow again, join me same time and subsequent program then day to day. We get news, we get newspaper review. You can join me again after 30 minutes. We will come back for get the newspaper review. Me and Femi Koka, they wish you a blessed day and a happy week ahead. Thank you very much for you take your time. We're not able for reading a message today, but definitely tomorrow we'll read them. Thank you. Bye.
Hi, please tune in to Women's Voice Online TV for your news, entertainment, and remember, it's the only online TV that focuses on women and girls. Stay tuned, always.
Women's Voice Online TV.
You dey watch Women's Voice Online TV, ensure say every day you stay clue to the fine program them where they put every day.
Not to all success story easy, and not to all struggle self-visible. But for Boku woman and girl picking them, the journey is full up with Boku strength and sacrifice them. Now that makes this platform they exist for talk about things like this, for share real life experience them, for celebrate achievements them, and also for address certain challenges them where woman and girl picking them they face. Because for protect the cause of woman and girl picking them means say you for team up stronger one with them, you for listen to them, and you for also support them growth.
Women's Voice Online TV.
Watch Women's Voice Online every day and be part and parcel of this journey in the life of women.
Be you man or woman, tune in to Women's Voice Online TV.
Sometimes they do something, but we for go viral, they go. When a good thing, where you come to woman, then go admire you and then go emulate you. But they be. But now that we get this online, I think say it will go far and wild, so that the other woman then go see the importance of woman there.
Inside Women's Voice Online TV, all voice matter and all stories set important. And this not only the beginning for protect the cause of woman and girl picking them.